So good morning and welcome. I think a lot of people in the room already know that modeling used in the AIDS in Asia Commission report from back in 2008 shows that if we continue with business as usual when it comes to the HIV response in Asia and the Pacific, more than half or almost half of the new infections by 2020, are going to be among men who have sex with men. And this prediction, we already know, is occurring in cities around the region, which have until recently ignored HIV prevention responses among men who have sex with men. That is, many of them have, not all, but many. A growing body of evidence shows us that in many places, men who have sex with men and transgendered people as well. I know this plenary is about men who have sex with men, but in terms of the issues that I'm going to speak about, there are lots of linkages between men who have sex with men and transgender people as well in terms of the basis of the homophobia, the discrimination, etc. So I'm going to mention transgendered people when that makes sense. So in many places, men who have sex with men and transgendered people are beginning to shoulder a disproportionate burden of HIV infections. Funding and human resource investments on prevention activities addressing them are still under-resourced, and consequently, the current interventions, even where interventions service delivery are being scaled up because of the unprecedented levels of funding coming into the region, mostly through Global Fund. So even where we have interventions, they lack the necessary coverage and scale to have any meaningful impact. Innovation. Innovative and effective approaches to HIV prevention efforts among men who have sex with men require a supporting, enabling, legal, and social environment, and that's probably the main reason they asked me to be on in the plenary today, is because that's a key thing that UN, as part of the UN Joint Response, is engaged in. This includes the removal of anti-sodomy laws and other punitive laws and policies, addressing discriminatory police and health sector practices, and ensuring the full participation of communities and national responses. These three facts are intractably linked. If we are to have a prevention revolution, which Michel Sidibe has spoken much of recently, and achieve commitments under the Millennium Development Goals, the UN Millennium Development Goals, these points need to be comprehensively addressed. As importantly, failure to effectively address this growing crisis will threaten to reverse the substantial gains made by countries over the past several years. I want to speak a bit about data. Men who have sex with men in this region now account for the majority of new infections in many of the urban centers and cities. In Ho Chi Minh City and Jakarta, HIV prevalence among men who have sex with men has tripled over the past several years. In the Philippines, men who have sex with men transmissions now account for 70% of all new HIV cases currently being reported. More concerning is that the rising rates of HIV among men who have sex with men are now primarily occurring among younger men who have sex with men, as well as younger transgendered persons. Now, Dr. Van Griesman, and I hope he's going to be in the room, will have more epidemiological data, but at a quick glance, HIV epidemics are changing rapidly in some locations within our region. I want to speak a little bit about revolutionizing prevention, which is something else we've heard folks talking about recently. Effective HIV prevention responses that are evidence-based, culturally appropriate, and rights-based is not only the best approach, it's the most cost-effective approach. In particular, data on emerging trends are vital in informing which groups and what locations are vulnerable to HIV transmissions and where gaps in prevention activities are. And the involvement of community-based organizations of men who have sex with men is important, not only because they can shape more effective prevention approaches and reach into vulnerable communities, they also operate as an essential bridge to the broader health and HIV treatment system. There was a recent USAID and UNDP-supported multi-city MSM and HIV initiative that revealed that community-designed and led responses are providing the next generation partnership building, innovation, and leadership. So what was revealed through the consultative process associated with that city's initiative? Partnership building with the health sector was revealed. The health sector needs to mandate non-discrimination policies within healthcare facilities and provide the trainings needed to provide appropriate services for men who have sex with men and transgender persons. In this region, WHO, WPRO, WIPRO is providing critical leadership in this area, while APN Plus has provided needed evidence on the barriers faced by men who have sex with men living with HIV when accessing healthcare services. Innovation with information communication technology. We have a new generation of community leaders among men who have sex with men, as well as among transgender people. And they're utilizing new technologies, like this thing here today that I could never do. Such social media and mobile technologies, and leveraging new partnerships to broaden the reach and impact of a city-based comprehensive response. Speaking of leadership, coalitions of community-based organizations from South Asian to Southeast Asia have demonstrated leadership by designing and submitting 2 multi-country global fund grants on men who have sex with men, transgender persons, and community system strengthening in HIV. And it's resulted in mobilizing over 50 million US, which covers 11 countries, not all the countries in the region, but 11 countries from Afghanistan to Timor-Leste. So while most national aid strategies now acknowledge men who have sex with men as a priority, government is still needed to provide the country resources to have a measurable impact on the epidemic among these highly marginalized and highly vulnerable folks. And I want to speak a little bit about the enabling legal and social environments. The UNDP Global Commission on the Law, HIV in the Law, which some of you have been engaged in, and I'm sure a lot of you have heard about, will present a final report with recommendations at the end of this year. And one of the members, the member secretary, Mr. Prasada Rao, is right here in the front row with us. And it's going to give us a better idea of the ways that the legal environment can be made to support and enhance HIV prevention efforts without preempting the findings and recommendations of the final report, especially since Mr. Rao's in the audience. It's clear from the outcomes of the Asia-Pacific Regional Dialogue on HIV in the Law that the following actions are needed. Decriminalization of same-sex relations. There are 19 countries in this region that criminalize same-sex relations still. And although enforcement varies across jurisdictions, the existence of such legislation stigmatizes and enables discrimination by law enforcement and social actors. These laws hamper the efforts to engage men who have sex with men in prevention, treatment, care, and support, and community strengthening efforts. Anti-discrimination protections. WHO in its recent guidelines on HIV and other sexually transmitted infections among men who have sex with men and transgender people recommended that all governments legislate anti-discrimination protections to eliminate violence and discrimination, the words of the report, and reduce the vulnerability to HIV transmissions experienced by men who have sex with men. Non-discrimination is particularly important so that prevention, treatment, care, and support and other services are accessible. Challenging homophobia, transphobia, and HIV stigma in health, education, and community settings. And as acknowledged by many community-based organizations, legal reforms are just the first step to creating a genuinely enabling social environment for HIV prevention. Social discrimination and stigma can have similar deleterious effects as the bad laws that impact on HIV prevention. In many country contexts, this is going to require engaging with religious leaders and faith-based organizations, and sometimes that can be quite complex and tricky, but I think we're going to have to do it. And I just want to note in this context of relative to data as well and challenging homophobia, there's new data released at this conference, a Fiji study report showing that up to 30% of men who have sex with men and transgender people in Fiji reported being assaulted in the last 6 months alone, for instance. And finally, social protection. For men who have sex with men, transgender persons, and people living with HIV, the effects of discrimination and stigma can result in social exclusion and poverty, thus hampering the ability of HIV prevention to effectively engage with these population groups. And many community-based organizations, human rights groups, and activists are already campaigning for these actions to be taken by government. And we're seeing increased openness from the international community and donors to support advocacy projects, which is what has to happen. These initiatives should be considered core elements of a comprehensive HIV response and not peripheral or optional extras. And advocacy takes many forms, depending on the circumstances. And we saw just this week the importance of creating space and safe space for all voices to be included, including those voices that are too often left out of the discussion, to make sure that they're heard. And in conclusion, I just want to note that the HIV epidemic, and you're going to hear a lot more about that from the speakers following me, among men who have sex with men, but also among transgendered people, is no longer looming, it's no longer hidden, it's no longer emerging, and all of these words have been used, including by UN agencies, including the UN agency I represent, even very recently. It's no longer any of these things. It's happening now. It's immediate, and it's in many cities in the region. It's now at crisis levels, and I think we need to begin to speak in those terms and respond in those terms. So progress on these issues have been made both globally and in the region, first of all by the communities themselves, by governments, development partners, and yes, the UN working together. Several countries in the region are demonstrating global leadership. And so, for example, I just want to highlight that Indonesia, Myanmar, and Australia co-sponsored the ESCAP resolution on HIV that committed governments to address and provide resources, critically, to prevent new infections among men who have sex with men and transgender people, and to support those people living with HIV. However, challenges remain on creating supportive legal and social environments which ensure the citizenship rights of all people. And just as important, the role of men who have sex with men and transgender people living with HIV are essential in the development of prevention strategies and to ensure that health services are appropriate and non-discriminatory. And I just want to end with the words, because it's obligatory, but also because I think it's appropriate, in the words of the UNDP administrator, my ultimate boss at UNDP, Helen Clark, the former Prime Minister of New Zealand. She said, "The law and its application can have a profound effect, positive and negative, on the lives of people, especially those who are marginalized and disempowered. And yet they can also be a powerful instrument to challenge stigma, promote public health, and protect human rights." And I think that through the rest of the presentations and discussion this morning at the plenary, this is exactly what we're going to be raising and trying to address as we move forward. So thank you, Stuart, and thank you.